Medical Innovation Project, where we made our own ER innovation to decrease wait times. Hello, my name is Frank Oropesa, and today I will be presenting our Biomedical Innovations Project, in which we have redesigned an ER room to be more efficient and to categorize each level of emergency to 3 floors, therefore making it faster and decreasing wait time. Today, I will be showing the path of 3 different patients admitted to the ER, each of them with their own experience and own treatments, as well as different tests and accommodations made to them. Thank you for watching. Patient number 8 has had a serious head injury, and therefore EMTs have taken him to the side entrance to be taken to the 2nd floor for urgent care. He will be taken through the elevator and after arriving on the 2nd floor, he will be led into an examination room, seated by nurses and asked questions. Later on, he will receive a medical evaluation by a neurologist. These tests include but are not limited to vision, hearing, strength, sensation, balance, coordination, and reflexes. They will also take a look at the patient's medical history for prior conditions such as this. Other tests such as memory and concentration will also be taken. Failure of these tests will result in further testing such as CT scans and MRI. A CT scan is a standard test in adults to access the brain right after an injury. Uses a series of X-rays to obtain cross-sectional images of the skull and brain. If the test has failed, they will be taken to an MRI, where tissue scans will be taken. It uses powerful magnets and radio waves to produce detailed images of the brain. After testing has been concluded, they will be taken back to their examination room and read their results. If they are in any discomfort, meds will be given for all of it. A neurologist and sports medicine doctor will collaborate to come up with a personalized plan to help return back to football. If needed, they will be hospitalized overnight to observe any further changes in their brain activity. That concludes patient 8. Patient number 9 has suffered severe lacerations on their hand as a result of a busted lawnmower while mowing their lawn. She has managed to stabilize her bleeding by tying a rope tourniquet around her wrist. She will be immediately taken into an operation room and seated. The nurses will apply local anesthesia on the lacerations. The anesthesiologist will apply anesthesia to the lacerations. Since the bleeding has been stopped by the patient, they can immediately clean the wound and sterilize it. Thereafter, they can stitch up the laceration with bandages. Thereafter, they can stitch up the lacerations and apply bandages. The nurses may remove the rope patient has used as a tourniquet and begin blood transfusion as the patient has lost a lot of blood. Since blood loss is immense, they will take an EKG to see the patient's heart rate and make sure the patient is not going into any kind of shock, such as hypovolemic shock. A patient's heart rate and blood pressure is back to normal. They take her to get an X-ray to examine if there is any damage to the bone. If there is damage to the bones in the fingers, they will put splints on the fingers. Our next patient is patient number 8. Patient number 8 has suffered lacerations. Our next patient is patient number 9. Patient number 9 has suffered lacerations in her hand after a faulty lawnmower has cut her. The patient has managed to use a makeshift tourniquet to stop the bleeding. They will immediately be taken into an operation room and seated. As the patient has HIV, any and all personnel attending to her must always be wearing protective gear, like goggles, gloves, masks, rubber bands around the cuff, etc., and must dispose of the gear after the treatment. An anesthesiologist will apply anesthesia to the laceration. Since the bleeding has been stopped by the patient, they can immediately clean the wound and sterilize it. Thereafter, they will stitch up the laceration and bandage it, and remove the rope used as a tourniquet. Since the patient has lost a lot of blood, they will begin blood transfusion. Also, to the blood loss, they will take an EKG to see the patient's heart rate and make sure the patient is stable and not going into any type of shock, such as hypovolemic shock. After patient's heart rate and blood pressure is back to normal, she will be taken to get an X-ray, where her hand will be checked for any bone damage. If there is damage to the bones, the fingers will be put in splints. Stool and urine samples must be done to ensure everything is okay with the patient, to ensure no further treatment will be necessary. This concludes patient number 9. Our final patient is an 18-year-old male who came in at 11 a.m. complaining of an incredibly itchy eye, which is red and appears to be releasing discharge on the eyelid, which is preventing the eye from opening. After checking in with the receptionist, they are led to the 3rd floor, which is meant for non-emergent experiences. Our last patient is an 18-year-old male who came in at 11 a.m. complaining of an incredibly itchy eye, which is red and appears to be discharging fluid on the eyelid, which is preventing the eye from opening. After consulting with the receptionist, they are led to floor number 3 for non-urgent cases. Taking the elevator, they will get there faster. After arriving on the 3rd floor, they will be led into an examination room and sat down. They will be asked many questions such as medical history, allergies, when did the condition start, pain of any kind, symptoms, and anything that may have caused it. Since this is an infectious disease, the personnel coming in contact with the patient must wear protective gear such as eyewear, gloves, masks at all times, and if it is not necessary for them to physically touch the patient, they must maintain distance. The patient will wait for a doctor to come in and examine his eye and hopefully diagnose him. The diagnosis shows that it is pink eye. The doctor will write up a prescription and any necessary sick days if needed and will send him on his way. That concludes the patient. Thank you for observing our ER Biomedical Innovations project. Have a good day.